Hi, my name is Andrea Weber, and I'm a clinical associate professor of psychiatry and internal medicine. In consideration of alcohol awareness, let's reflect on our drinking habits and how we can support healthier alcohol use among friends and family. So how do we define high-risk drinking? High-risk drinking is defined for adults of legal drinking age as more than 2 drinks in a day for men or more than 1 drink a day for women. One common myth has been the belief that alcohol use in moderation, for example, a glass of red wine a day, might have health benefits. More recently, observational studies that in the past attributed some health benefits to wine or other types of alcohol have now been carried out long-term, and the results were often confused by participants' other lifestyle choices like exercise and diet. Basically, alcohol consumption does not provide health benefits. Additionally, in my practice, I treat many patients with alcohol use or other substance use disorders. One of the important points to make is that alcohol use disorder is a medical condition with available treatments. One of the things we want to work on is reducing the stigma and the barriers that people face asking for help and accessing treatment. Treatment for alcohol use disorder frequently consists of cognitive behavioral therapy and pharmacologic interventions, oftentimes in combination. There are several FDA-approved medications to treat alcohol use disorder, which can provide significant benefits in both abstaining from alcohol or in reducing heavy alcohol use, yet they are often underutilized. It's estimated that less than 10% of patients with a diagnosis of alcohol use disorder receive prescriptions for these medications. Furthermore, most patients with alcohol use disorder present to their general practitioners as there is a scarcity of specialists in addiction medicine. Here, we are working to enhance the workforce and access for patients to providers with expertise in addiction treatment through our Addiction Medicine Fellowship and by having medical learners rotate in our addiction medicine clinics.
As a hospitalist, I take care of patients who need to be admitted to the hospital when they are significantly ill. And in the past few years, we have seen an increased number of patients that are admitted to the hospital due to severe illnesses related to alcohol use. Additionally, we're seeing with growing concern that many of these patients are younger, in their 20s and 30s, and we're seeing also more women affected by these problems. In fact, many of them are losing their lives way too early due to the devastating effect of alcohol. Chronic alcohol use can lead to many chronic diseases such as high blood pressure, heart disease, stroke, mental health problems, liver disease, and a rising number of cancers, which the University of Iowa College of Public Health recently reported as a growing concern for Iowans. But it's not all doom and gloom. There are steps that we can take to assess our level of drinking and seek help if necessary. Self-awareness is the first step. Being honest with ourselves about how much we're drinking and how it is impacting our lives. It is easiest to start drinking more without even realizing it. I challenge all of us to take a serious look at our own alcohol use, keep track of how much we're drinking, and set limits so we can prevent the serious consequences of alcohol use.
Every time you drink alcohol, it will get absorbed by your GI tract and it would go through your liver. And consuming more alcohol than your liver can handle, unfortunately, can lead to very serious health problems. Initially, the first step, we call it fatty liver, or we have a new term called steatosis. And this can be reversible if you stop drinking, but if you continue to drink, this can affect your liver in more significant ways, causing what we call inflammation. And that liver can go into a severe phase known as alcoholic hepatitis. Those patients, unfortunately, can get very sick, and depending on their liver scores, they can have a 50% or more chance of not surviving. The good news is liver damage from alcohol can frequently be prevented, and this is truly our most important message. Prevention, but for the most part, awareness. We want all of you to be aware of what alcohol can do to your liver. Make sure you make the right choices and hopefully prevent significant liver damage before it happens. Communication is essential in medicine, so make sure you talk to your healthcare provider and they can provide different interventions if needed. They can identify the extent of liver damage. We have an incredibly active liver group at the University of Iowa, and we're always open to help our referring providers and our patients to try to identify people at risk, to try to provide different interventions for each patient, and making sure that we support you. Keep in mind that it's never too late to start making the right and healthier choices for your liver, for yourself, and for your life. Thank you very much.